It's 7:31 now. Let's start recording. As you can see, today is a bit different. I'm sharing my screen at the moment. What you can see over here, this is an English presentation, PowerPoint presentation. Then what happened on the side here, there is a translation from audio to text in Chinese. So if you're a Chinese speaker, then you should actually focus on here in between. So we have some video to show you how to do the needling, and then you can swap to here to actually watch the video. So for you, if you're using iPad, cell phone, then like my cell phone in here, they 4 icons under here. So you can go, I suggest you use the first one. The first icon that you can see my person on the top and the presentation on the side, on the bottom. Okay, the PowerPoint on the bottom, and the video will be in all photo and contents will be in the bottom. The second icon, which you only see me, I don't recommend you do that. The third icon is chat. If you have any question, then you just come to here. Okay. Now, of course, I'm going to use. I need you to sign up if you want 1.5 CPD. Then I need you to log into our heath platform to watch 14 seconds of video. The first one, and the second one I think is about 11. The first one I want you to log in. I'll show you how to log in, and then once you watch the video, that's it, and you come back to this live video, which you need to use your browser. I suggest you use another browser to do that. Let me think about it. Then in the end of the live webinar, and you need to log in again. If you're first time log into the heath platform, then you have to create an account. If you have logged in before, then you just need your email and your password to log in. And I'll show you later on how to go through that. And then once you complete the targets in the platform, so easy, then our platform will automatically issue you a certificate, okay, which I need to set it up later on. Okay, we'll go. If you're using computer, that's even better, because when you use computer, you can see both the chat, the PowerPoint presentation, and my person, all 3 windows together, and that's actually an idea for it. If you have computer available, I suggest you use on computer to sign in. Okay, let's have a look how many people we have right now, and I'm trying to record this as well. Okay, I'm actually recording it anyway. We have 70 people online. Thank you for joining in. If you can hear me and you can see what was going on, please reply 1. 如果你可以听见呢，你可以请回复1。可以听见可以看见，请回复1。That's fantastic. Thank you very much. All right. Today, let me speak up the topic in Chinese first, because I find that when I I have run a test before about the topic, and then it translated differently in Chinese. So let me share with you, tell you what exactly the topic today. 所以今天的那个主题应该是立竿见影啊，中医调脉啊，调结构的腰痛、腰腿痛速效策略。哦，我们会有一个真实的案例给大家哈。等下那个翻译呢，会可能翻错这一段话。So the topic today is instant results, fast acting TCM pulse, and structural regulation strategy for lower back and leg pain. So basically sciatic pain, right? All right. Now we're going to follow acupuncture 1, 2, 3. Right. Acupuncture 1, diagnosis. Acupuncture 2, treatment principle. Acupuncture 3, treatment method, which is choosing the points. Or you can do Chinese herbs or whatever you want. Okay. Now let's straight away go into the case today. So this case today is 7th, right? This case, the patient came in 2 days ago. The conditions is here. Patient reports a history of back pain episodes over the past 20 years due to maintenance plumbing work involving frequent bending and working in confined spaces. I've had a few events with it, probably 5 times, when my back's gone to the point of going out in spasm. That's what the patient told me. Most recent back pain started after a drainage job last week. So he hurt his back last week, initially on the left, and then moved to the right side. So last night was about 10 out of 10, real bad. I was really thinking about die last night. So pain has persisted since Sunday, with initial strength on Thursday and pain starting Sunday. The orthopathic treatment, he went to osteopath. I think chiropractor. I think it was probably a chiropractor or osteopath. I can't remember clearly. On Tuesday, free it up. It was working very well, but then it comes back again. Let's keep going with that one. Functional impact requires stopping activity during severe pain. So he's a plumbing. Luckily, he's a boss. He doesn't have to work that hard, but he did require to went to the site to do some work. That's why I make it worse, and he can't do anything at the moment because it's too painful. Previous acupuncture in Frankton worsened symptoms initially, and that was about years ago. He had a bad experience with acupuncture, so that put me on very pressure, a lot of pressure, right? Because he had a bad experience with acupuncture, but he still came to acupuncture. That's very lucky for me. So that's partly because he went to chiropractor, osteopath, and it got better, and the pain came back again, real bad. So he think, okay, you need to change something else. So he came to me. Shoulders and knees currently unaffected. Report occasion migraines. That's because when I look at the pulse and ask him, and we look at the tongue and pulse, I ask him, wow, it seems like you have a headache or dizziness. Do you suffer from that? I'll show you how I actually can tell from the tongue. He said probably in the last year, he had 4. So every 3 months, maybe. When he was little, he got a lot of migraine, but since after as age and then fear of it doesn't actually come so much. But then last year he came every 3 months regularly. 3 months he get a migraine. So, and how could I tell from that, from the tongue? I'll show you later on. Okay, this is one of the diagnoses, very important. No regular alcohol consumption, but when he said no, which means he'd been reduced his alcohol consumption. He had a lot of alcohol previously, but now he cut down to every Friday, just heavy Friday. He said we had our work due, but since Friday, I had one beer on Tuesday. He now regularly take alcohol on Friday. So why would he say that? Because when I look at the tongue, I say, well, it seems like you have a liver damage. Are you do you consume a lot of alcohol? So how could I tell? I'll show you later. Okay. Sleep has been okay. No problem with dizziness, occasionally headaches. Okay, that's it. Right. Before we go further, I think we got enough people coming in now. I think you need if you need the 1.5 CPD, that's something that you need to do right now. Let me share with you what you're gonna do. Well, this is the first time I do AI translation, live instant translation. This is something that you should do. Now, before you do anything, okay, I'm not going to show you the link yet, but I want you to see here. So I'm going to place this to you, this link. Okay. So what you're gonna do, you won't see the windows like me in here because I can see all the courses in my backend. Once you scroll down, you see instant results, fast acting TCM pulse and structure regulation strategy for low back and leg pain. All right, this is a way to go. Otherwise, you need to go to on the bottom. You see on the bottom, you go to last. Then you can see that in here. All right. So there's two ways to go to here. Right. Once you go to on the sidebar, on the left of the sidebar, you click in or you click in here. All right. Once you log in, first you need to log in first. All right. Over here. Now you see I have a draft video here. I have sign in video here. The sign in video is available for you to watch. The final sign in to get your certificate, I have not released it yet, so you can't watch it and you can't get your CPD certificate yet. So once you go in, I want you to click sign in video. This is what happened, and then you're going to watch this. There's 14 or 30 seconds. Okay. Once you finish that, you let it play. You finish that, and you complete lesson. Right? You must click complete lesson. All right. Then you don't have to do anything. Do not go to the next lesson because there's no next lesson. Okay. Just click complete lesson. That's it. Right. So the first sign in, I want you to do it now. Here you go. That is the link. Please sign in, and this is the first step. If you want the certificate, I'll give you 2 minutes. Okay, 2 minutes. And that's 45. You have, and do not ask any question. After 2 minutes, I'll get you to actually I'll give you I'll speak in Chinese. OK，该那个步骤呢是让大家呢要拿那个证书啊1.5的证书，在 chat 里面你可以看到那个 link。OK，在那个 link 里面呢，你去点击像我刚才演示的那个方式，去 log in，然后去找，然后看一个14秒的视频就可以了，好不好？好的，好，给大家一些时间哦，I'll let you have some time to work on. If you can't remember your password, you have to just click forgot password and then just reset your password and call on again. Right? Right, that's it. You don't have to tell me you're done. When it's time, I'll just start. Okay, let's go. Okay, if you haven't signed in yet, that is the one that you have to go sign in and watch the video. All right, let's go back to this. Right. Right. Look at here. I want to share with you something in my clinic, right? And as well as this case. So what I do in my clinic, right? In all cases, even with back pain, in acute back pain or chronic back pain, the thing is, I want a complete. I want to see the whole picture. When I say whole picture, is I'm not just treating the pain, because I understand pain may not just simple as uh, blockage in the meridian. The blockage, the underlying issue may be from the organs. That's number one. Number two, of course, blockage in the meridian. Number three, the structure. So in my diagnosis, in my examination, I have 3 points to go in. One, organs. Number two, meridian diagnosis. Number three, structure imbalance. Okay, I hope that makes sense. Then, when I say organs, I'm looking at the tongue and the pulse, right? So this is the tongue of the patient. Can you see the tongue of the patient? So I mentioned about the sleeping and the headache. Why would I ask the patient, do you have a headache problem? You have migraine? Do you have dizziness? Do you have sleeping problem? Well, when you can tell, our tongue, it should be round over here. But the patient's tongue at the moment, you see, it's actually flat. And that means the blood in the brain and the head is not enough. Or we call it the heart blood deficiency. That's it. Very simple. Right. Are you following? If you're following, please reply 2. If you get me. Very simple, right? This is the what I call tongue diagnosis. Very quick. And now you know you need to tonify the heart. Hang on, I'm trying to fix this thing. Well, that's good. Great. If the tongue is flat, it's not round. You see my tongue? It's round, right? But this tongue is flat. We call it flat tip. So the flat tip tongue represent the head problem or the heart problem. Because the heart, the blood deficient, it can't go up to the head. So we think about it, when the blood is not going to the head, what's going to happen? Not sleeping well. The quality of the sleeping is not good. Or dizziness or headache, migraine. So those symptoms, you ask patient, they may have just have one or they have all of them, right? This is how I pick it up. Now, this is a liver area. Can you see the crack? The cracking, a lot of cracking spot over here? on the liver, there's insufficiency and the cracking in here, that is damage in the liver. That's how I can tell. So I asked him, do you have a lot of alcohol? And then he started that he had a lot of alcohol previously, he cut it down, but it's already damaged. I can tell straight away. Are you following how to tell that if they have a liver damage? When I said the liver damage, they may not have any. When they go to scan or blood test for liver function, nothing wrong with that. But according to Chinese medicine, you can tell straight away from the tongue. And this explains why that he went for treatment and the treatment doesn't last or the treatment doesn't work well, because the liver control tendons, control nerve functioning, liver control joints. So when the liver function is weak, then the tendon has not got enough strength. When the liver function is weak, the tendons has not got enough strength. If you hurt yourself, you're not gonna recover properly due to liver functions weak. Does it make sense to you? If it does, please reply 3. So this is how I linked the organs function to pain conditions. So if you just treat the symptoms, you're not going to get the long-lasting results, or you may not going to fix the problem properly. Right, of course, we can see cracking line over here, which is insufficiency on here, and then you can see that here is insufficiency as well. A lot of cracking line over here, so in qi deficiency, and we have teeth mark over here, or spleen qi deficiency, right? Sign of the coating present over here. You see that is the thick in here. That is dampness. All right, that's dampness. On lower jaw, you can see in here too. And the lower jaw should be flat, but it's not in here. So the tongue should be all flat, you see. But in the lower jaw, which is the kidney area, the tongue has a narrow tongue on the side. And then what happened? There's a depression over here. And the depression represents kidney deficient. Are you following? And the tongue over here, both sides. On the both sides of the tongue, it should be wider. But as you see here, that is so narrow, and that indicating kidney weakness as well. And from here to here, we call long tongue. The long tongue also represent blood deficiency. Okay. Let me check. Under the tongue. When you look at the tongue, under the tongue, we can see that the big veins block over here that we call blood stagnations. Right? Blood clot, blood stagnation is a toxin, very toxin in the body. That's it. You see that tongue on the same day, if the patient force the tongue out, and you can see that there's more relaxed and the color of the change, right? And you can see here, there's insufficiency over here and here as well. All right, so that is more accurate, but we can see that even though he force out the tongue and the tip is still flat. All right, the tip is still flat. All right, the acupuncture 1 is diagnosis. In my acupuncture 1, I use tongue for diagnosing the organs, and I use pulse to diagnose the organs function. All right. And I use tongue to look at whether there is any dampness or whether there's any blood stasis. In acupuncture 1, I also look at the leg to see whether there's any structural problem. In this case, you can see this is this foot and this foot. If you look at this video,
This is right foot young.
this is the right foot young. It's a bit hard to tell in this ankle, but this leg, right side, as you go toward to the outside, to the lateral side, right? The picture is not taken very well in this case, but hopefully you can tell. Now, question: do you know what does right foot young mean to you? Do you know anything about right foot young? Okay, I can see that in the Chinese it called yang means 年轻 young. It's not young, it's yin yang. 它这边中文翻译是错的哦，不是年轻哦，应该是右脚阳。So right foot 阳 yin yang 的阳。And the Chinese translation is very wrong. It said the right foot young, like old and young, the age. It's not right. Okay, this translation is not good in here. So yin leg and yang leg. Yang leg means you put the needle on the yang meridian. If you choose the yang meridian point, you needle on the yang leg, which in this case is right leg. If you choose any point on the foot in meridian will be choosing on the left side, because left side is in meridian. Let me explain in Chinese, because I can see that the Chinese translation is very wrong. So 我解释一下哈，阴阳角是这么辩证哈，针刺一阴阳角。现在我们决定了检查的时候，右脚是阳，右脚是阳角，所有的穴位取在阳经、足阳经上面，应该取在右脚上面，因为右脚是阳。所有的穴位如果是取到了足阴经上面的时候呢，应该扎在左脚上面，因为左脚是阴。我看到翻译有点错，所以请你们不要跟着那个翻译哈。我看到有错，我会及时给你改正，谢谢。Right. TCM diagnosis. This is a bit of conclusion from the structure. It's left foot yang, Y-A-N-G, yang. Okay. In is Y-I-N. Let me train the good. So left foot yang is the left foot, Y-A-N-G. And right foot is Y-I-N, in. And the post diagnosis, I did not show you, but in one of video, I quickly take the post, and I found that on my post diagnosis is very quick one. I don't spend hour to take the post. I don't spend 20 minutes. I will spend within 1 minute, or sometimes only few seconds. I get the result of my post diagnosis. So in this case, it's very fast because all the poses and the root are weak. Either they are weak, they were weak, or they have no root at all. So liver, heart, spleen, lung, kidney here is kidney in, kidney Y-I-N, kidney yang, which is Mingmen, kidney Y-A-N-G. The tongue diagnosis, we found qi in deficiency, blood deficiency, dampness, and blood stasis. There are more, but the pulse covered anyway, so I'm not going to find more detail on the tongue. So that's my acupuncture 1. What have I just missed? I have structure, I have pulse, I have tongue. I have missed the meridian diagnosis, right? The meridian diagnosis, the patient told me it was on the GB meridian, which is gallbladder, and bladder meridians. So on those 2 meridian mainly. So those 2 meridian have a blockage. I think over here is wrong. I put it left side. It should be right yang foot. Right Y-A-N-G. I should say Y-A-N-G in here. Okay, if you look at here, the pulse, the root of the, if you look at over here, TCM diagnosis in here, on the red color, all 5 organs are deficient: blood deficiency, blood stasis, phlegm damp, qi and yin yang deficiency. Not just yin deficiency, yang deficiency as well, which is YIN and YANG, both deficiency. Meridian blockage in the left, sorry, left and right side. Initially, the patient said it's right, but after needle and he showed me also right, left side as well. So GB and UB are those 2 meridian, and right YNG foot, right yang foot. That's it. Let's go. Now we have all the diagnosis. What should we do? Acupuncture 2, treatment principle. So we need to tonify all 5 organs. Tonify the blood, transform phlegm, dampness, and remove the blood and resolve stasis. Tonify qi and nourishing yin and yang. Unblock the meridian, balance yin and yang structure. In the acupuncture 3, which is the treatment, then I'm going to show you all the points. I have all videos to show you the points. So acupuncture 3 is treatment, acupuncture point. When I come to acupuncture 3, which you have all the diagnosis, how are you going to treat this? I'm doing acupuncture on this point. But when I do acupuncture, I choose the point. I have chosen point according to the organs because they are organs imbalance. So the points for the organs and the point for unblock the meridian. When I say acupuncture point, the first one is to be unblock the meridian one. That makes sense? So this point I unblock the meridian, and I have point for structure. Balance the yin yang, which is YIN and YANG, the yin yang foot. And balance the organs. I point to balance the organs. If I'm not going to use acupuncture, what should I do? I can also do Chinese herbs, moxibustion, cupping. I can do tuina massage. I can do whatever you want, whatever you can think of. This is acupuncture 3 treatment. So that's my acupuncture 1, 2, 3. Let me show you the acupuncture point. First, I choose the 3rd Bagua, navel acupuncture. I use 5 needles on navel, on the umbilical point. Right? The umbilical point, which we call 神阙, in Chinese is called 颅内 brain point. It's wrong. 应该是脐身肚脐哈。So the navel point, umbilical needle I use 5 needles for 5 organs. Okay, let's have a look in the video.
See myself on YouTube.
And then you're gonna be famous.
Yeah.
You have to recognize your own belly button to be able to find yourself. So this is like a hernia.
Can you see the
but
video?
it's still very safe.
Someone
You
said
don't
there's no video sharing.
penetrate
There is now.
directly in here. Got a bit of hernia on your
Very button, yeah,
belly
man.
button. So that's still very safe from doing this. So there's kidney in, kidney young, and heart. And that is spleen.
First point here is kidney in, kidney YIN, kidney yang, kidney YANG over here. And over here, this is for the
And this
spleen.
is lung.
And the needle over here is for liver, and here is for
And
lung.
the tonified technique.
And I'm doing tonified technique. The tonified technique over here.
Time is talking.
For all organs.
Are you hungry?
Yeah.
Have you had breakfast yet?
No.
No. Okay. Not good for acupuncture then.
No.
No. We have to be careful. Like not standing for acupuncture, not sitting for acupuncture, because you may have low sugar and it may cause you dizziness or faint. The needle. It may. Yeah. The pulse better. The root are better.
Okay. Question. Why do I do pulse first? Why do I do organs treatment first? Now, this is a question for you guys. Oh, can't you see the video? The video is over here. I just play it. Some people can see it. Yes. Yes, yes. You can see the video. That's no problem. For those you can't see the video, you can watch the replay later on. Okay, we have replay. Oh, my question is, why do I choose? I have organs. You see, in my diagnosis, I have organ deficiency here. I have structural imbalance here. I have meridians blockage here. Why don't I do the meridian blockage and balance the structure? Why did I choose to do the organ first? That's a question for everyone. You can put your, there's no wrong or right in here. Can you please type something in the chat and we can discuss it? Because organ have the chi and blood. Awesome. Strengthening the root. Awesome. Organs are in, you treat the in deficiency. Awesome. What else? There's no wrong or right. And whatever you put in there is very awesome. You are right. Okay. This is my thinking. According to Huangdi Neijing, okay, it said when the qi and blood, when the structure qi and blood in yin, yang yang are deficiency, do not do acupuncture. Use herbs instead. So we have meridian blockage, we have structural problem, and the patients have a lot of pain. But also he had organ deficiency. So I'm trying to get the organs have more blood circulate first. Because when the organs function better, the spleen and stomach control muscle strength, and the muscle strength will be better. The kidney control bone, the bone will be better, have more strength. Liver control tendon, joint, and nerve functioning, and those things will become stronger. You see, then what's going to happen? Then next, if the pain's still there, we go and unblock the meridian, we go and restructure the structure imbalance, then the structure will be more stable and you have enough blood to unblock the meridians. That is why I choose to treat the organ first. Right? Does it make sense to you? For long-lasting result, that's amazing. So this is very important. I just say for long-lasting result, that's fantastic. That's amazing answer. I love it. Because I find that if you just unblock the meridians or you just simply treat the structure, balance the structure, you can get immediate result, no question. But then the lasting result, it does not last because you have not got enough blood in the organs. So the structure are weak, not have enough strength. Doesn't make sense. Oops, something's wrong. Can you still see? My phone can't see. I'm not quite sure what happened. You can. Hang on. Let me fix it. I'm not quite sure what happened. You can hear me, but you can't see me, right? Yep. Good now? Thank God. Thanks God. Okay. Did you hear my explanation why I did the organ first, not the structure, not the unblock the meridian? Oh, that's awesome. Then we can skip then. Don't have to repeat then. I thought it cut off. Awesome. Then did it make sense to you? If you want to get long-lasting result, that is a first step you need to do. And this is why sometimes when you unblock the meridian, when you do the structure, you get instant result, but you don't get lasting results. It only lasts for a few hours, right? And this is why sometimes you treat it very well, the technique's no problem, but you don't get any result. You don't even get instant results. Or sometimes when as soon as you take out a needle, the pain comes back straight away. You get me? All right, let's go to the next thing. My advertising for you. Are you from Auckland or New Zealand or Australia? If you are, please reply 3. I have good news for you. Awesome. I have good news for you. In 2026, February 14 to 16, I decided to have a post-balance acupuncture workshop in Auckland. I think I put the price wrong, This is not the right price for it. Forget about the price. Um, so that what happened over here is you can check the price and here later on. Which I just discussed about the post diagnosis and the navel. And someone asked me, can I actually tell you the way um, the point, explain the point? I can't, because with the point of a navel acupuncture, when I teach it, I need to go for at least 4 hours to teach everything for 4 hours for navel acupuncture, at least 4 hours to explain way, because female and male are different points. So in February, there's a link you can go. If you're Chinese, you can go and click the Chinese link, or you can save it first in English. If you're English speaker, you can click the English one. What happened is we and in this 3 days, I'm going to teach everything about how to take the pulse and see the tongue, and make a quick diagnosis in the for the organs and start to treat it. All right. Then we have AI translation to 60 languages. So the AI system is very different. I'm not going to use that one. This one is a free one. Okay. And the other one costs a lot of money. So I'm going to get it in, and that AI can translate from English audio to Chinese in text, and as well as an audio. So you can listen from your cell phone and look at the cell phone and look at the PowerPoint that they have text in Chinese as well. Of course, want, if you speak other language, that's available as well. So that's in New Zealand, and that is in Berlin. This is in Berlin, Germany, in March from 6 to 8. Same thing, post balance acupuncture. Any of you from Europe, can you just reply 3 or reply 4, please? Okay, there's still a early bird price in this course. If you want to join, please, this is the link that you should save right now. Right. And again, we have AI translate to other languages available in Berlin, Germany. Okay, let's continue. This is the first point I choose. Apart from the umbilical point. Let's have a look.
Tender here?
Sun in Jiao,
On
on the left side.
Here?
Yeah.
That one or that one?
Yeah, yeah.
That one, eh?
Spleen 6.
This is spleen 6. San Yin Jiao.
The Chinese translation is wrong again. It's not
25?
Sun in Jiao, it's 3. 3 in Jiao.
Okay. 重新再看一个。
Okay. My question for you: Why do I do spleen 6? 中文的错了哈，应该是三阴交哈，三阴交穴不是这个山在交哈，还是阳在交不对哈。So did you see my technique? Why do I choose San in Jiao spleen 6? Now we're open to discuss. What is your understanding of San in Jiao in here? Yeah, thank you, Miko, for typing in San in Jiao. 谢谢 Miko 哈。 3 meridian meeting the point because spleen is muscle. Yeah, everything's right. And yeah, good. Point where 3 meridian intersect. Okay. You see, when I have all my diagnosis and then when I choose the point, I choose the point always one stone, two birds, or one stone, three birds. Remember, I said when I choose the meridian YIN in meridian points, I choose I needle on the left side because left side is YIN in foot. So when I do that, I treat the structure, I balance the structure. That's number one. Number two, spleen 6 is a blood point. So when I apply tonicify technique, I am narrowing or reinforcing the blood. Does it make sense? So I'm treating the blood because this patient have blood deficiency. You get me? So spleen 6, choosing the YIN in leg. I'm treating the structure, balancing the structure. Number two, spleen 6 is a blood point. I'm applying tonicify technique. So I am treating what? I am narrowing the blood. Number three, yes, like you say, 3 meridian going to spleen 6. So this 3 meridian, it can, which is spleen, liver, kidney, those 3 meridian can balance all 12 meridians. Right? If you have attained my New Balance method acupuncture, I've shown you a quick and dirty way. Spleen 6 is the main point to treat a lot of things. Right. The next video. Are you following? If you are, please reply 5. This is left side again. 血海 spleen 10.
spleen 10血海。你要先找到层次以后开始做手法。This is reduce to move the blood. That's it.
Right. What technique did I apply in this case? On spleen 10, what I mean is 血海. Reduce technique. Why do I do reduce technique in spleen 10, 血海 point? Because this patient have a condition when we make the diagnosis we call blood stasis. Spleen 6 and spleen 10 are both blood points. So I tonicify spleen 6, then I reduce spleen 10 for unblock the blood stasis to remove the blood stasis. Are you following? Yep, move the blood. Awesome. I use that a lot. But if you're following, please reply 6. Now, 阴陵泉 also on the left side. 阴陵泉 also on the left side. Let's have a look at the video.
Yeah, there's a little bit there.
A little bit, eh?
Pushing, yeah.
Spleen 9阴陵泉，从侧拍。You feel that?
Mm-hmm.
Boy. Tonicify first.
Yeah.
You feel a jump?
Let's feel it come up the back of the leg.
Good. Okay, now we do misuse technique. Okay, that's it.
Right. What technique did I actually apply in this case, on this point? So in Ling Quan, I needle on the left side because left foot is in foot. So I balance the structure first. Secondly, I choose this point because this point can remove the dampness. It can remove the phlegm. Okay, so 痰饮痰湿. So I do tonic fight first and then reduce after. Why do I do this? Because the spleen energy was weak in the diagnosis, right? So I do tonic fight first. Then why do I do reduce? Reduce means I want to reduce the phlegm and dampness. That's simple it is. Okay. So when I do that, I target two things or three things actually. One is the structure. Number two, spleen deficiency. Number three, dampness. So this point is so powerful. Do you get me? If you're following, please reply 7. So I'm going to guide you step by step to look at all the points that I need. All right, before we go further, there's another advertising. So in New Zealand again, if you're from Australia, New Zealand, this is good for you. So New Balance acupuncture. So for those points I just show you, we talk about structure, right? The structure point, when I choose the point for the structure, when I choose the point for the dampness, those things I teach in both I teach in New Balance acupuncture workshop, right? I teach in New Balance method acupuncture. I don't teach structure in post balance acupuncture, which is different thing, right? So you want to learn this technique, you can join my New Balance acupuncture workshop in Auckland next year in February. As you can see here, the date will be the same from 14 to 16 February 2026. It's actually exactly the same as here, post balance acupuncture. This is this is very confusing for you, right? This is because I only have 3 days. I'm gonna offer you, you're gonna sign up. Whoever want to join, you sign up. Let me know which course you want to be in, and I will choose the one that I have most people interested, and then I host that course in a workshop in Auckland. I hope that makes sense to you. Then in the Auckland one, let me see you. Let me see. Yep, that is the one. If you are interested to join New Balance acupuncture in Auckland, that is the link. One English registration link, and the other one is Chinese registration link. Again, this course will teach in English and translate to 60 languages. If you're interested, please sign up. We have the same course, New Balance Acupuncture, in Berlin, Germany, March 14th to 16th. Because I go to Europe once a year. So I'm going to make it happen for post balance acupuncture 3-day teaching and New Balance method acupuncture 3-day teaching. Okay, so I make that happen for you. That's still $100 that you can save discount if you sign up before 30th of December. Let me show you the link for registration. Again, this is if you speak Chinese, you can join too, because with AI to actually um, translate it instantly. All right. This morning, when I wake up, when I woke up this morning, I look at my WeChat. I just got back from India a couple weeks ago. So, uh, Dr. Sachin applied a deep needling on UB1, Jingming point, UB1, to treat a patient who had suffered from blind, can't see, no vision in the eyes. I think it's from as you can see here, lost his vision after stroke. Then he actually had treatment for 3 or 4 months, according to here, and actually better. His vision is better. But then adding on the deep needling on UB1, it got even better. So this is what I tell my students all the time. You come and join this class, New Balance, either New Balance acupuncture or post balance acupuncture. You learn all this technique. You still keep whatever you do. Whatever you do has been so successful already, and you don't want to drop anything. You want to come here and to learn some new technique, new points, which the UB1 Jingming deep needling. This technique I learned it from my master in Malaysia, and no one has taught this for the English acupuncturists, not even Chinese acupuncture. Not many people know this technique, but it works very well. This is the beauty of local points. This is a special point. Right? If you need a Jingming, a 0.3 chun or 0.5 chun, it does not work that well, or it does not work at all. You have to needle 1.5 chun, right? 40 mm. And all people, a lot of patients experience from this point, they get instant release from it, in which I needle for a lot of my students in India. They experience that. So I just want to share with you, this is a special point we teach in New Balance acupuncture workshop. It is a big bonus. Right. Acupuncture 3, Feng Long point. Right Feng Long on the right side. Now you see, let's watch the video first.
Feng Long, stomach 40. Tonic
Stomach
5 first.
40. I do tonic 5 technique first.
Then reduce.
这是丰隆穴胃经的。
What is it?
Oh, oh,
Going down?
yeah, yeah.
Quite a strong one, eh?
Oh,
Okay, done.
Okay, so why Feng Long point? Why do I do the techniques? What technique did I apply? Did you see it?
Feng Long, stomach 40. Tonic 5 first.
I do a different direction. Do you see the needle?
Then
我用不同的方向。
what is it?
我先做补法，再做
Going down?
泻法。
yeah.
So I do tonic 5 first, and then I do
Quite a
reduce.
strong one, eh?
Oh,
Okay, done.
Have you ever heard about 龙虎交战? 龙虎交战 is one of the techniques that you do tonic 5 first, and then you do reduce, or you do reduce and then you do tonic 5. So they're both technique in one point that called 龙虎交战, which is dragon and tiger fighting together, which means it's very strong. sensation. And that can actually bring a lot of blood into the point, and then reduce a lot the function of the point. And that is and particularly treat pain. Right? That's called 龙虎交战. So I don't do a lot of stimulation in here, but I do just few times, and the patient get strong sensation in here. Oop, what's going on? Are you following? Why do I do stomach 45 in here? It's because first I choose this point, stomach 45 Feng Long point. It can work for stomach. So I do tonicify for the stomach function, stomach deficiency. Secondly, I do this point, I do reduce technique. I applied reduce technique for reduce the phlegm, dampness. Number 3, I choose on the right side because this patient have the diagnosis of yin and yang, yin yang diagnosis. The right foot yang. Does it make sense to you? So I treat the structure as well. So one point, I have 3 meaning in it. I hope that makes sense to you. 40, sorry. I said 45, did I? Should be 40, sorry. Feng Long should be 40. I'm so sorry. I made a big mistake. This point is right as the point between GB and UB. Let's watch the video.
Yeah. You have the video? Yeah.
Here, right?
Yeah. Like here? Yeah. Like here. Yeah. Yeah.
Here,
So, okay. So do you have other uncomfortable symptoms? Other symptoms anywhere else in the body? No. No. Everything's good just here. Yeah. I mean, I got tested for my eyesight. It's good. I'm taking the antivirals. Oh, yeah. And I can see, but before my eyes were watering. Yeah. Not too bad now. Okay. Okay. Normally shingles here. Yeah. So I got my shingles here. Oh, okay. In my head. Okay. So head. Okay. And eye.
Yeah.
And just
What do you feel?
So, only right side. So no.
You feel a jump?
Shock there.
You got shock in here, right?
Yeah.
Jumping over here.
Nothing here. Just this
Big one. There you go, another one.
Above the eyebrow. Above eyebrow. Okay. Okay. Let's line up it.
Okay, try it out.
So I choose this point. I choose this point between GB and UB, and I choose the access point. I choose a below one, below knee, right? Below knee, I can treat pain over here, right? So on this level, I mean, then I do 常规探穴. So this point is mainly for the structure, to be honest. So 常规探穴 means one needle going in, I do a different direction, and I get jumping sensation. And this jumping sensation is very powerful. It can rebalance the structure very much. Okay, that is I teach this in new balance acupuncture too. Right. And after that, I've done the structure, I've done all this organs thing, and then the patient, I did not actually show you the other video that the patient feel better. So I missed the video. The patient feel better, but then it's not completely better yet. He can still feel the pain. And what do? I'm focusing on unblock the meridian using naval acupuncture. So this is one of the technique I call 导引针法, 导引 method. And it's very easy.
Here. Right, lift your right leg up, please. Straight up. How's your back?
No.
From the needle or from back?
Back. To.
Yep. Where is it?
There, it's starting to go there.
Mm-hmm. It's quite sharp in the back.
Yeah, it's starting to.
The other side of your leg?
That's about as far as I can go. I've got a little bit in the same side.
Can you show me exactly where the pain is?
In the back?
Mm-hmm.
And here. That's what we do. Yeah.
Okay, thank you.
The above side goes up slightly.
Yep. Lift your leg up again, please.
Which one?
So 导引
Right.
method also
Sorry,
mean
no rush.
动气疗法 and master tongue acupuncture. So you needle, stimulate the needle, very gentle.
The better?
Yeah.
Sometimes patient does feel
Put it
pain
down.
from the needle. So you do gentle needle in there and you ask the patient to move the leg.
Up again.
And the needle that I stimulate in this point, let me,
Yeah, that's all right.
It's okay. Get it down again, please. Slowly
so
up again.
this point, this area
So while you move,
is actually
Okay.
for
stimulate the needles,
Uh,
and that is called kidney and the bladder meridians.
kidney and bladder
Where you
meridian.
just show me where the pain is was kidney and bladder.
Mm-hmm.
So somehow when you lift your leg and the blockage is there, it can't go past.
Okay.
So when I do this, while you move your leg, and it'll help
Yeah,
analyze
little
where the
blockage.
blockage is, and it can
Okay.
go and unblock it. Thank you. Right, the left leg, please. That's okay?
Yeah, a little bit tight, but no real pain.
Okay, down again. And up.
So in here, you just need to gentle
One more time, please.
twitching the needle. That's it. So he was having pain when he lifted
Down
his
again.
leg up, and now
Pretty okay at the
the
moment?
pain turned to
Yeah.
just tightness.
Okay. I want you to bend your knee. And the other side too. Thank you. Then I want
All
you
this
to
movement was
lift your
painful
forearm up,
when
please.
he before the needles.
Slowly.
That's why I get him to do it
Where do you feel
again.
pain?
Same.
Same
Yeah,
way, eh?
yeah,
Okay.
yeah.
So no rush. Slowly lift it up.
Mm-hmm.
Put it down. Up again. Down. How's the pain?
There's a little bit there, but not what it was just a minute, second ago.
Lift it as high as you can. And move it from side to side. And how's that when you move from side to side?
Slightly tight now.
The tightness is on the back here, also on the side there.
So, yeah,
Still on the
sort
side.
of same
Okay.
spot.
Thank you. Still on the same meridian.
Same thing.
Keep going.
Side to side.
Yes, please. And put it down. Up again.
Side to
Side
side.
to side. Yep.
Yeah, it's better. It's a little bit tight, but
So tight. Okay. Cool. Thank you.
So what's Dowing method mean? Dowing method mean I have a needle in my hand on a distal point, and I put a needle in, and then I get the patient to move wherever the pain is. In this case, is the lower back pain. So I needle the navel, put the navel, and then I ask the patient where is the pain. If the pain is in this case is in UB meridian, so I go and stimulate the UB meridian points. That point connect to the UB meridian. So I stimulate the point, and I ask the patient to move. So that can very easy and very quick to unblock the meridian in the lower back. Then if the patient tell me that the pain is actually in what? In GB meridian, I'm gonna change my hand to the GB meridian point, and then to stimulate that, and then get the patient to move again. And you change different movement, different position to ask the patient. And what position or what movement should I get the patient to do? I actually check it before needles. Any position, any movement, that patient felt the pain while they perform that. And this is now you want to do the needle, use dowing and get them to move. Does it make sense to you? And this dowing method can apply to any needle method, not just never acupuncture. So if you do scalp, do the scalp. If you do needle on the hand, you do needle on the hand and you ask the patient to move. Same thing. All right. This is very good for pain relief, especially when the patient have pain restrict them to move properly, or while they move uh, uh, um, perform a movement and they suffer from pain, they experience pain. Does it make sense to you? If you get me, if you understand, please reply 8. Thank you. So previously, long time ago, when I just applied naval acupuncture, I stop here. I take out a needle, I get patient go home. Right. Or I do acupuncture 1, 2, 3, unblock the meridian, the pain gone, I get patient to go home. Or I take the pulse and I get the pulse balance and the pain reduced or pain gone, I get patient to go home. Is it what you do? I should get patient go home, right? The pain is gone and there's just a little bit of tightness. That's it. The patient should go home, right? No, this is not me. Not anymore, because I have a very clear diagnosis. So I use more needles. I'm not my needle. When I decide what needle to give the patient, is not because I stop the needles, not because the pain reduced or the pain stopped, and I stop the needle. You see what I mean? I stop the needle when the pulse get better. That's one thing. I stop the pain when I do enough needle for the structure. So all my needle and up until now, they are all distal points. I have not added any local point yet. I have not added any point for the spine yet, for the pelvic yet. You see? So I want to look after pelvic and the spine, because in my knowledge, stabilize the pelvic and stabilize the spine are very important for lower back problem. If you don't do that, the lasting result won't be good. So that is my experience. That's why I don't do, up until now, I can get patient to go home, but I'm not doing that. I do more needle. And when you come to my clinic, they say, why do you do more needle? You know, you should stop the needle. No, because this is in my experience. If you stop now, the lasting result won't be good. You have to combine local point and distal point. If you just do distal point, which a lot of people now do only distal point, and you're missing something, you must, for me, I must do some local point to get the spine better. And then this case will last, the results will last longer. Right? This is my intention. Does it make sense to you? This is Zhu Wu Li, liver 10.
But when I do this here, you're not just feeling better with your lower back, your shoulder and neck, you feel better too. Okay. What is it?
Okay, from your pulse,
A jump?
I can see
Shooting up the groin, right?
Why I know it's weak because of that pressure.
Yeah, I can feel it twitch. You feel twitching, right? This is Chinese torture, you see, isn't it?
I always tell a patient this is Chinese torture when they feel pain. Uh, so for when you look at here, this is new to you. Okay, I want to share with you a bit more. Um, when when I feel the jumping sensation under my finger, and same as the patient, they feel jumping as well. And this jumping is actually called 得气 or called 气滞. This is according to 黄帝内经 气滞. When you get this sensation 气滞, which is the qi, not qi zhi, not qi stagnation, should be qi arrive, called qi zhi. So qi arrive, we call qi zhi. What you meaning? Most people say de qi right now. It's the same thing, right? Not the qi stagnation. When I look at here, it says qi arrive, okay? Qi 到了叫qi zhi, right? The translation is not very good. I'm so sorry about that. So this point is very good when you needle on the in point. You should needle liver 10 whenever there are any problem in the spine or in the pelvics. This is a very strong point. It stabilizes the spine very well. It stabilizes the pelvic very, very, very well. And this point should needle on in, YIN, in foot. And this patient in foot is on the left side. Let's go to the next point. So as I said, I'm going to do the spine. This is the point for the spine. UB23, Senshu, long needle.
Yeah, I can feel the spine is not on alignment. Put both hands down on the side.
So I check the spine first.
Here.
It's not in alignment.
But I do suffer from stress, like stress, from work. Work, sometimes family, sometimes just worrying about nothing. It's just stress. So anxiety, depression, anxiety, not depression, quite positive but more anxious. It's very important for me.
I record this video and I also record the audio from the next door of my colleague, so you can hear very clearly. And the AI translated all about his audio. This is a long needle, 75 mm. The needle going in touch the bone. It's very safe if you know how to needle correctly. It won't punch the bladder or kidney, so don't you worry about it.
Down, right?
So the sensation going down to the buttock. Then I recheck the spine. Oh, rechecking spine is over here, the video.
That's okay now.
That's all right.
Roll over on your back, please.
It's a very quick needle, just one needle, and it can actually realign the spine. And this is the last point. So when you do the spine or on the treat the back pain, a lot of people forgot about you only do the distal point, you only do the back point, and you probably won't choose any point in the groin, which is level 10, which I do a lot. You probably forgot about the tummy point, and which I do a lot too. Here you go, the tummy, right arse point on the stomach meridian in the tummy.
Tummy.
Tummy point.
That means
blood stagnation. Oh, does that? Yeah, it's the diagnose of your whole body. Right? You get a twitching too? So what I'm gonna do first, going down, right? Yeah. Good. Now, to another one. To make your circulation better.
This is in the kidney meridian.
But to be honest, just one session. Okay.
Final results.
Feel pain, right? Initially, now how you feel?
Yeah.
Still quite painful?
It's clear. Today I ran.
No, I mean,
I can.
and then start to walk?
I can stand up.
You can stand now. Yeah, that's much clearer. You were very slow with this.
It's been,
And then sit down again and see how you feel. Enough? Much freer. Right?
Yeah.
But I'll tell you, you're not fixed yet.
No.
Unfortunately, it's not one time fix it. And I want you to come back next time. If you're in a long form, I want you to come back. I want this.
So, in this case, the patient's happy with the lower back problem. So, I want to share more with you. Initially, the patient couldn't actually do that. The worst pain is when he sit from sitting position and to stand up. When he came to me, sit and stand up, it was very slow. Unfortunately, I didn't take the video for you. Otherwise, you can see the difference. He couldn't walk like this. His movement was very slow. Now it's quite free for walk and everything. So I make sure that the patient know what's going on. It's not one-time fix, even though he is feeling much better, much less pain, and move freer. Because if I don't tell the patient this, the pain come back, and the patient what would the patient think? Oh, it's just one of those practitioner that pain come back. I told the patient very clearly that if I give you treatment today, you get instant results. You get much better. It doesn't mean you fix because you have an organs deficiency. I explained about the liver, about spleen, about kidney, how they contribute or as a factors for the back pain, for the structure, how they connect to the structure. Then in the end of that, I tell the patient that you need to come in for Chinese herbs, or you need to come in for more session to focus on your uh, organs function for with acupuncture. If you don't do herbs, which I do herbs in here, so I get the patient to come back for Chinese herbs. You see what I mean? And as well as acupuncture. So this case is a quick acupuncture. You don't have to retain the needles, but if you want to retain needle, you can do that too, right? So I get a patient quickly in and out of the clinic. With this technique, you can treat a lot of patients. You treat organ structure and unblock the meridian, and you can still treat a lot of people, right? So if you want to learn this technique, my whole system you need to learn. You can either start from post balance acupuncture. You can either start from new balance acupuncture. If you have learn the new balance acupuncture, you haven't learned the new balance post balance acupuncture yet. I have a workshop in New Zealand and Berlin, and welcome to join. Thank you. Right, I think we come to the end. This is New Balance Acupuncture Workshop Foundation one. On the course, what we include meridian balancing, right? Unblock the meridian, which means structural balancing, which is yin yang foot diagnosis method. Strategy for combining local and distal point selection, right? Hand-on practice, clinical demonstration, and I'll give you a full color print of menu when you join the class. A lot of bonus in this class. I'll show you how to actually deep needling Jingming, which is UB1, right? And I'll show you how to do green turtle props the points or this thing. Another course to actually introduce to you is, as you can see here, this is before and this is after. This is a client after giving birth, big tummy, after 5 training. And this is before, this is after. You see the tummy get much better for body shaping. So you see here, and then this is only 4 times of training. And this is 6 times, right? This technique called Yichen TCM constitution based body shaping training. Over here, only 2 times for this. So in 3 weeks' time, I'm traveling to Malaysia. We're gonna host this class in Malaysia. You see, 3 hours. Well, people say 3 hours. How come the clothes all change? 3 hours in here means 1 hour training per session. One session, 60 minutes of training. So that's after 3 sessions of training, you can see a big, huge difference in here. So this is very fantastic technique. It's 3 days spleen and stomach regulation for waist and abdomen slimming. This is the workshop in Berlin, Germany in March from the 10th to 12th. Right? If you're interested to learn this class, and Ethan only speaks Chinese, so again we have AI translation. Much better AI than today. Okay, I'll be in there to make sure everything happen in the right way. So there's 2 registration links in here. One is in Chinese, one is in English. If you are Chinese speaker, you can click the Chinese one. If you are English speaker, you can click the English one to join. How long between the 2 sessions? You can do weekly. Or you should come and join us in Malaysia next year. We're gonna have the class in Malaysia next year. You can have some result with Moxa, of course. All right. Any question? This is a Malaysian one in 3 weeks' time. If you want to join the Malaysia one, I think we can still get you in. I have Malaysia one is only in Chinese. We don't actually prepare for AI. But if you want to join, then you can prepare your own AI translation into your own language, which I have one people from Mexico who is traveling 2 days ago. She decided to join and he asked me. I said, well, you have to prepare for on AI to translation for yourself, and I'll be there for helping you. But because I'm busy over there too. So if you want to join that, yes, come in and join. The class in India, we're going to India for this Eastern workshop as well. I think we schedule I can't remember when, but it will come next year in India, definitely. All right, so you're welcome to join. So that's about it for today. So final, I'll send you need to log in. Before you log in, I'm going to set up the certificate for you. All right, do not do anything, just give me a few minutes. I'm going to set it up for you. Okay, I should do this. So don't do anything yet. Just I'm going to show you how I actually set up the certificate. So if you need the certificate, stay tuned. If you have any question, please wait for me. I'm going to set up the certificate for those who need the certificate. Am I on the right account? Let's see. Give me a minute, eh? Am I doing the right account? That's strange. I'm trying to do my certificate. Let me logged out and then log in again. Here you go. That's not the one. Give me a minute, eh? I have to set it up, the certificate, otherwise it won't be automatic for you. Height platform. It's not working. If I do here, not that one. Yep, I think I've got it in here. That's great. Go to certificate. Sorry, not very familiar. Create certificate. Oh. I think I have to reset my password. There you go. I've tried it before when I set up the password, and then when I do that, it doesn't actually work. So I have to create it right now rather than set up before. Let me see. Let me see you. There you go. Okay. Stay tuned. Not your turn yet. I have to release this video. Publish this video. So again, for you, when you log in, I'll give you the link later on. Just let me show you first. If you log into here, you see, and on the sidebar, on the left side, you can click here. If you want to find from here, you can go to the last, and then this is the one. You can either click from here or click from here. All right, I'm gonna do it in here. Now you have watched the first video. Now you watch the second video. The second video is only very, very short. So when you've played the 10-second video, you do complete lesson. All right, nice work. That's it. You see, you get the certificate I've got the certificate. If you did not complete 2 video, you won't get the certificate. You see what I mean? So where is the certificate? Let me show you. Again, I'm not familiar. Okay, it's just showing you. So you go to the right top over here. Then you go view profile. Then in the view profile, you get view. You see view certificates. Then that is where your certificates. And if you want to view it, just go and there. Here is your certificate. And you have 2 ways to get into your computer, download to your computer. One is click here. Then you get print and then save PDF into your computer. Secondly, you can do a screenshot like this. Okay, I've showing you everything. So if you have any question, just contact us and we'll be able to help you. Right? Let me show you the let me give you the link so that you can actually sign in. Here you go. You can sign in now. I'll give you 3 minutes. Yes. The reason I did not send the link to you because I don't want you to go to the link because you don't know what's going on. So I want to show you everything before you actually click the link. Here's the link, okay? 好。那如果你是讲中文的，我来解释一次哈。你刚刚看到我的演示，对吧？你是讲中文的，对吧？你刚才看到的演示呢，就是说，在我进入这个以后，对吧？你要去这一边去 click 这一个 instant result 发行页，然后你把这个 video 给看了，第2个 video，OK，看完以后呢，你刚才这边有一个 complete lesson， 你动了 complete lesson 以后，然后你就 continue to course list， 然后你就会得到你的 certificate。你的证书在这里是哪里拿呢？就在这个上面的3个横，有没有？右上角这个3个横，然后你看 view profile。view profile 这边呢，你看 view certificates， 然后接下去你就自己处理了哈。我已经说过了，英文就 view 这个，然后你可以做一个 screenshot， 这个就可以直接在你的电脑里面了，看到吗？存在你电脑里面，或者是呢，你按这个 view and share public page， 然后你再按一个 print， 然后你就可以存在你的电脑里面，好不好？好 ，question time。question. Okay, I'm going to put that into here. I'm going to do this. Okay, I'm going to do this. I know some of you have question. I love you have question too. I'm trying my best to bring the thing back here. Here, this is the one. Right. What is your question? Let me stop sharing so I can. Okay, let me look at your sharing. Your question. So here's the question time. Someone said, thank you. You're welcome. Can we have same result with Moxa? Yes, you can, but no, you can't. If you do Moxa for deficiency of organs, some of them you can do that, but no, if you try to do Moxa for the structure, you can't. Moxa can probably do a lot of works, but if the patient have heat, you don't do moxa. If the patient have cold, then you do moxa. Some pain is because they have a lot of heat in there causing pain. Then you choose the same point, you do moxa, it doesn't work. How long between two sessions? Okay, I've answered that. What point we can do for liver damage that we saw on the tongue? The liver damage, so there is iron deficiency, there is blood deficiency. So spleen 6 is very good. Spleen 10 is very good too, because 血海 and 三阴交 are both blood point. So the pulse show that there's no root in the liver. So in formula, 四物汤 is very good. In this case, can you explain why you didn't use any arm channel points? Aaron, I can use the arm point. I'm just didn't actually thought about that to go into it. Yes, you can. That's not a problem at all, right? Because it's enough, And then in my New Balance acupuncture and the structure, I'm more focused on the leg because legs is the foundation of the entire body. If the legs point good enough, I don't actually go to the arm. But if I need to unblock the meridian, I can choose the arm point. Well, if I do more structure, most time I do local point, and if I do distal point, I'm more focused on the legs. One of the reason because legs is the foundation of the entire body, not the hand. But if the pain in the hand, I'll do the arm point. Hi, America. Yes, it is possible to review this webinar. We have a recording. I got the certificate. Thank you. Awesome. Thing I would have added a answer point on the right arm in area, 指责 and 灵骨合谷 left arm and to balance top of the bottom. Yeah, good idea, Aaron. I totally agree with you. There's no problem at all. Your 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 strategy are very good, and thank you for sharing. If you forgot your password, like what I did, it can't actually log in. Just reset the password. Password. For America, we can't. We don't do certificate manually because we have too many people join this program. And once you log in, you do the forgot your password, and then same process going in and do those two video, and then you automatically the platform automatically issue you the certificate. Can't remember. Okay, you have to watch the video. This video will upload to the platform, and then you can actually go into the platform and rewatch the video where you can get the certificate. Okay, Patrick, thank you. Why moxa does not work for few patients? I have explained that. Hope that makes sense. Thank you, Aaron. You have a good week too. Thank you, Patrick, for helping out. Yep. Thank you. That's it. Any more question? I have read everything. I don't think I have any more question that I haven't actually asked. Answer. Oh, this is my first time to using instant AI translation from English to Chinese, and next time, hope that I can train the AI better. I didn't think of the yin and yang thing that it can't actually recognize, but I think right foot yang, right hand yang. I think you get it now. Yeah, well trained. Okay, thank you. I stop the AI. 有证书，你跟着我们做就肯定有证书哈。If you miss the beginning part of the video, you can actually rewatch it, replay it later on. Once we upload to the platform, my assistant will send out an email, and you can log into. If you're in our group, we'll send the announcement in the group as well. So add me. This is my WhatsApp. If you This is my WhatsApp, and we'll invite you into the group. If any question, you can ask in the group. My receptionist can answer. Yes, everyone can get the video replay. It's enough platform. Please contact my assistant. Add me on just contact me on my WhatsApp. Thank you. That's it. I'll see you next week. Bye bye. Next week, probably same time, we're gonna do that same thing. See you. Thank you. Bye.